So it's my pleasure today to welcome Dr. Rao from Edmonton, who's going to speak to us a little bit today about some of the work he's doing in more remote areas. So welcome, Jaggi. Nice to see you.
Nice to see you too, Gabby.
So, so please just let us know a little bit about your practice and what sort of outreach work that you do as part of your dermatology care.
Sure. I'm a dermatologist practicing in Edmonton, Alberta, and I've been in practice now for 21 years. And when I first started practicing, it was only in Edmonton, Alberta, but then I was invited to go to other areas of Alberta, as well as to the Northwest Territories, which I gladly accepted because it's a nice opportunity to see the rest of the world and to help out people who just don't have a dermatologist in their region. And so I've been doing that in some capacity for the last 20 years, either directly in person or remotely by teledermatology.
Amazing. So I guess the question I always throw at people is, what factors led you to want to do this kind of work as opposed to just focusing on your central practice?
Yeah, it's a good question. There's a lot of factors. I think one is personal factors. I mean, we go into medicine to help people, and indeed, we do have that as part of our mandate. So whether we're on call or whether we're seeing patients in our clinic, we do get people from remote regions. The problem is not everybody can come and see us. So in Edmonton, we have a very large area. We see Northern Alberta, the territories, including the Yukon and the Northwest Territories, mostly the Northwest Territories, Eastern BC and Western Saskatchewan. And the people who are fortunate enough to be able to travel, access the transportation can come and see us for their skin problems. But there's a lot of people who just can't. They can't even come to Yellowknife, which is a large area. I guess you can almost call it an urbanized area, but there's a lot of rural areas that they just can't come to. So the alternative is for us to go to them. And so one, it helps them if we can somehow do that. At least there's less distance for them to travel. The other is for us to see that part of the world is actually quite interesting and amazing. So if you haven't been to Canada's North, I'd encourage everybody to do that at least once in their lives. It's just a remarkable place geographically, but also the people are very kind, and it's very nice when you have a skill set, a knowledge set that you can apply to help people there.
Yeah, it's true. We've actually got family in Yellowknife, and it is a really weird and interesting and unique place for sure. Yeah, I've only been once. Tell me, what do you find unique about working in a rural community like Yellowknife, compared to an urban center? What is special and unique in that
Yeah,
environment?
Yellowknife is kind of like an urban center. It doesn't have as much of the resources as, say, an Edmonton would or Vancouver would or even Toronto would. But it does have quite a bit. What I've had the great pleasure of doing is going not only to Yellowknife, but also to Inuvik and to Norman Wells and a couple of even smaller towns like Colville Lake in the Northwest Territories, which is quite amazing. What I've noticed is that going from more urban to less urban, we see people who rarely see physicians at all. I mean, there's people there who live in small towns and might see a nurse practitioner, a nurse in charge. They call it an NIC up there at most. And so as a result, they may not be getting the proper care that they need, either for diagnosis of different health issues, not just dermatologic, but internal medicine issues, but also the treatment of these different conditions. So sometimes we see people who are in advanced stages of the various conditions that they have present to us. So even though as a dermatologist I can visually see the effect of some of these external conditions, I also take a look at the rest of their health, and I notice that maybe something else hasn't been taken well care of. For example, their diabetes. Or maybe other internal ailment. So they often will present quite in advanced stages or even late. For example, certain malignancies, by the time they present to us, it could have probably either been taken care of at an earlier stage or maybe prevented altogether.
Can you expand a little bit on what you find uniquely rewarding about working in these communities?
Well, I think the people themselves, generally speaking, are quite thankful to be given the opportunity to see a specialist. because again, they don't see a specialist with the frequency that you might be able to in an urban setting. So they don't take it for granted. They know that specialists will only come at a certain time, and that could be very infrequent, sometimes even once a year, or even less. So they really don't take it for granted at all, and they appreciate the service and the attention that you're giving. The other thing that I noticed is that the resources that we may have there are not as at hand. So we take a lot for granted in a tertiary care center. We'll say, okay, we want this to be tested or that to be done, and it's usually done with the help of our nurses and other, even our administrative team, where you really don't have all of that there. And sometimes it's this is another reason I would encourage everybody to go, is it really stretches our capacity for ingenuity and creativity. And it's easy for us to write a prescription and it likely will be covered, or we can give samples. They may not have all of that in a rural setting. So you have to be very thoughtful and figure out a way. How can we get this medication or this procedure done in a very efficient manner?
Yeah, yeah. I'm also curious at the flip side of that question. What is uniquely challenging? You mentioned complex cases, multiple comorbidities, access to certain therapeutics, but what are some other unique challenges when you're caring for these patients throughout the year?
Yeah, sometimes a medication may not be available. So for example, let's say an advanced therapy like a biologic agent or a JAK inhibitor. Nowadays, the companies are making it available to rural areas. But initially, when it first came out, it was extremely challenging to get people on advanced therapeutics. Even something as seemingly simple in an urban area like methotrexate. Would be very challenging to get in a rural area like Norman Wells. How do you get that when there's really no pharmacy close by? And then even to transport a medication like that to that pharmacy can be extremely challenging. And then you have to think about other issues like its shelf life. And can it survive through the cold? And how do you transport it properly? The stability of it. These are things that certainly come to mind. And then there's this whole issue about advanced technologies like lasers. And I'm not talking about for aesthetic medicine. We're talking about using it to improve the quality of life of medical conditions, or somebody who has a lot of warts on their hands. It's not life-threatening, but it's debilitating. Sometimes we use advanced technologies to do that, and that may not be readily available or accessible.
For sure. When you have to manage really complex cases, how do you orchestrate that given the distance and visit, frequency?
Yeah, that's a very good question. I think a lot of it has to do with triage. So we might be able to handle it on site, using different ingenuity, different maybe alternative off-label treatments that can sometimes work if you don't have the preferred treatment available. But sometimes you have to send people out and maybe arrange for them to come to either your clinic or a clinic that's somewhere nearby to them. And it's extremely challenging to do that. And a lot of telephone calls. There's more administrative work involved in doing that. And as you know, we can't do everything ourselves. Sometimes we have to refer to another specialist. And it's very challenging to do that in a rural area because sometimes nobody else comes up there.
Yeah, it's limited, and then it's back to traveling again. What resources do you think could be what supports and resources could be better developed to do this kind of work better?
I think the biggest thing is to get more people to come out there. So if we had more brains there and more hands and more eyes, I guess in our case, that would be the first step. I have the privilege of being the residency program director for my university. So I encourage our residents to do that. In fact, we're trying to create a mandatory rotation for them to come up with either myself or one of our other full-fledged dermatologists, not only to experience how amazing it is and how rewarding it is that we just discussed, but also maybe they might get used to it. And if they see it, it might inspire them to, once they graduate, to also do the same thing. So I think we need to do a little bit more of that with our younger people, our residents, and maybe even earlier than that. The other thing we should really consider is how do we create maybe even a training program there, or like some kind of a remote place where they can stay for a longer period of time, maybe 2 or 3 weeks, and have some degree of independence or remote supervision so that they can maybe help and then do rotate like this. I think it'll make them better specialists, but also will help the population there.
I'm hearing almost from everyone I'm speaking to that exposure at the training level is so critical to anticipate ongoing relationships like this. So my other question then is, what sort of incentives do you think, like financial, educational, professional, what sort of incentives would push or nudge dermatologists to do this kind of work, do you think?
Yeah, I think the first thing is exposure, as we touched upon. That's how I got interested in this. As one of my early mentors, he was 3 years ahead of me, Dr. Norman Wazel, dermatologist, practiced in Edmonton. Now he's in Toronto. He used to go up frequently, and he took me with him as a resident. And I thought, wow, this is just amazing. And it almost deified him in my mind. I thought, wow, this guy's a hero. He's going up here and doing this. And in a way, if you stress that to your trainees, let them be a hero as well, and they certainly have that capability. They have that skill set and knowledge and hands, and maybe going into an area where really people do need it. Then they might want to give back and pay it forward by doing it themselves. So exposure is very important, and showing them that it can be done, being a role model for them. So maybe even pairing up with people who are doing preceptorships. This is very critical, and I think we should foster that. Second is financial remuneration. I think the government should consider doing that, and they do. In the province of Alberta, there are some incentives, not for a visiting a specialist like myself, not yet, but there certainly is for doctors who stay up there for a longer period of time, say 3 to 6 months. They give them a surplus or a bonus for doing so. And then I think even at if you wanted to go ad hoc, even a few times, I think that regional governments should consider having some degree of funding to do that, not only for the transport to and from, but maybe accommodation and meals. That would be very nice. If they don't have that, then we should think of creative ways to maybe fund people who are interested in doing this.
Definitely. And this might be a bit of a repeat of what we've already discussed, but what advice would you give a dermatology resident if they were thinking of setting up practice in a more rural environment, in addition to the things you've mentioned?
Oh, I would highly encourage them to do that. I think that you would start slow. So, meaning you have to decide how many people you're going to see, how you're going to see them. You do need to have the infrastructure to do that. You need to have nursing support. There has to be, you have to be very careful not to burn out. There could be an overwhelming supply, and we've seen many physicians unfortunately burn out. I'm very cognizant of that, and we try to teach our residents anyway to not bite off more than they can chew. And they do have to have certain boundaries in terms of when they work and how they work. But I think a lot of support is required, support staff, and definitely the government should be very supportive too.
Yeah, that's something we need to front load if we're going to do this kind of work, is to make sure that it's not so overwhelming that it's a flash in the pan, right? And you want to have longevity in that relationship. So true.
Yes.
Finally, Jaggi, what sort of initiatives do you think the CDA could offer to support dermatologists who do work in rural and remote communities?
Yeah, there's a few things it can do. I think one is maybe pair people who are interested, even at the residency level or maybe at the junior dermatology level, with those who have it already set up. So if you have an experienced dermatologist who's going to a rural area of Canada, I think matching the two together would be great. If there was some degree of financial support, that would be excellent. And if they have the ability to bill, that's great. We would help to get them a license, maybe administrative support to do that in the province or territory that they're planning to work in. If not, then maybe some type of a funding stipend, just to help them to offset any costs of doing so. And maybe some of them even have a junior practice that they're leaving. So and they may not necessarily initially make more at the remote practice. So just to offset that would be great. And then I think finally maybe even share back sessions and try to pass the torch, right? So that they can inspire other people.
Yeah, I think those one of the strengths of our organization is that we can connect people, right? And so if we can collect the people doing the work, it can just strengthen the ties. So brilliant.
Absolutely.
Thank you so much for your insights, Jag. It was really great to speak with you. It's fascinating work, especially in the areas you've worked in. It must be very unique and special.
It's my pleasure and honor. Thank you so much.